Ayesha Anwar, and today I'm going to be doing a PCA bag change. So before we get started, I'm going to do my hand hygiene and I will review my physician's order and compare with the MARS. So we have Marcy Paris, FIN 1, 2, 3, 4, 5, 6, 7, 8, 9, FIN 1, 2, 3, 4, 5, 6, 7, 8, 9. There'd be a date of birth as a second patient identifier. The order is for 1 milligram of morphine as a PCA dose, 1 milligram of morphine as a PCA dose, 5-minute lockout, and we have a signature from 2 transcribers, so we're good to go. I've reviewed the physician's order sheet. Now I'm going to go ahead and look at the PDM. So we have a morphine sulfate. It's a high alert medication. It requires a 2-nurse check. Opioid analgesic. It can be administered by a nurse or student nurse. And the maximum dose, or the dose range, would be 1 to 10 milligrams per ml. The usual dose is 1 to 3 milligrams. And we have the compatibility of it is normal saline, which is what we're going to be using. So I have a mini bag of normal saline over here. And the recipe for the PCA is that we have to draw up 50 milligrams of the dose of the medication, which will come down to 5 mils because we have 1 mil ampules. We have 5 of these 1 mil ampules, and all of them are concentrated with 10 milligrams per ml. So that's the concentration. And we're going to be using 45 mils of the normal saline, which I have in the bag, and to get a final volume of 50 mils and a final concentration of 1 milligram per ml. So I've reviewed the PDM. Now I'm going to go ahead and do my first check with my MAR, with my PDM, and with my vials. So I have my MAR, my PDM, vials. So we have right patient, Marcy Paris, FIN 1, 2, 3, 4, 5, 6, 7, 8, 9, right medication, morphine, and we have a PDM for morphine sulfate, morphine, 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 morphine. We have the right drug. Right dose is 1 milligram. According to the PDM, we are going to be drawing up 50 milligrams. So we're going to be using the 1 mil ampules that have the concentration of 10 milligrams per ml. We're going to be using 5 of those, so I have 5 of these, and I'm going to check the concentration of each of them to make sure it's the right one. So we have 10 milligrams per ml, 10 milligrams per ml, 10 milligrams per ml, 10 milligrams per ml, 10 milligrams per ml. So we have the right dose, and we're going to be drawing up we're going to be mixing it with 45 mils of normal saline, which I have, to get a final volume of 50 mils and a final concentration of 1 milligram per ml. So we have the right dose. The right route is PCA. I have the PCA MAR, I have the PCA section of the PDM, and I have the right time is now today. So I've done my first check. Now I'm going to go ahead and start drawing up my medication. So first thing I'm going to do is draw up the normal saline. So I'm going to be using aseptic technique to attach this, and I'm gonna draw up 5 mils of the normal saline to ensure that I have 45 mils in the bag. So I'm gonna go ahead and clean it for 15 seconds, 30 seconds, 30 seconds has passed, dry for 15 seconds has passed, and then I'm gonna go ahead and aseptically take out 5 mls into my syringe. Okay, so I've done that. And I'd be using the scoop method to ensure safety. And then I'll just go ahead and attach this label to my syringe to make sure I don't get the medications mixed up. Okay, so I've done that. Now I'm going to go ahead and start pulling up my medication. So I'm going to get a 10 ml vial for that. I like to use a 10 ml vial instead of 5 ml vial because I can see all the dose and then I can maneuver it when I need to. So I'm going to aseptically attach a blunt fill. Normally I'd be using a filter needle for ampules, but since these ampules are already open, I don't need to use a filter needle, so because they wouldn't be able to drop any of the medication. So I'm going to go ahead and do that aseptically.
Insulin. So select insulin. I should populate everything for me. I'm going to grab my MAR. And we're just going to prepare.
Okay, so I've drawn up my medication. Again, I'll be using the scoop method. And then I'll just maneuver it to make sure I have the right dose.
I have 100 units in my bag here.
So I have 5 mils in here. I'm going to quickly go ahead and attach my label to it. I've attached my label. Okay, so now I'm ready to do my second check, and then I'll ensure that a nurse does an independent check with me to make sure that I have the right medication. So my second check is with the MAR, PDM, my drawn medication, my vials, and my mini bag, as well as my labels. So we have right patient, Marcy Paris, right order, or right medication, morphine, 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 and I have a PDM for morphine, and I have morphine drawn up in here as well, 5 mils morphine. Perfect. So I have morphine drawn up. I have the right dose of 1 milligram per ml, 1 milligram as a bolus dose, and according to my PDM, we drew up 50 milligrams of the medication, which came in 1 mil ampules with the concentration of 10 milligrams per ml. So we drew them up from 5 of these ampules. So I'm going to double check to see if I have the right dose. So we have 5 mils in this syringe, and I have it written over here as well. So we have 50 milligrams, and we have 5 mils into the syringe, and the concentration of this was 10 milligrams per ml. So I'm going to look at the concentration: 10 milligrams per ml, 10 milligrams per ml, 10 milligrams per ml, 10 milligrams per ml, and 10 milligrams per ml. So we have the right concentration. We're going to be mixing it with 45 mils of normal saline, which I have over here because I drew up 5 mils of normal saline in the syringe, which I will put in the med waste. So I have done my second check, so I can get a nurse to do an independent check to make sure I have all the right medication. A nurse has done the second check, so now I can go ahead and inject my medication. So I'm going to use an alcohol swab to clean this for 30 seconds, dry for 15, done that. And then I'll go ahead and aseptically inject this medication. So 5 mils, I'm going to inject it into my bags to ensure that I have the volume of 50 mils because there's 45 mils into the bag. So this can go into the sharps container. I'm going to attach my label.
And at the time the bag was supposed to be documented.
Wrong side. I'll attach my label here. So I've gotten all my supplies. I'm going to take my MAR and my mini bag, my label, go over to the bedside, do my hand hygiene, engine safety check. Patient's bed has been lowered to the ground, cobble is in their reach, and patient is in a comfortable position. So patient is in a comfortable position. I'm going to introduce myself. Hi, my name is Ayesha Anwar. I'm going to be your student nurse today. I'm just going to have a look at your wristband. So I'm going to be comparing it with the label, with the MAR, with the wristband. So we have right patient, Paris Marcy, Paris Marcy, Paris Marcy, and I'll just ask them to verbalize their name and their date of birth. Okay, patient's done that. And I'll ask them if they have any allergies. They don't have any allergies, so I'm going to continue on with my third check before I go on to educate the patient. So we have the right drug. We have morphine, and the right dose, 1 milligram per ml. So according to the PDM, I have 50 milligrams in this bag because I drew them up from the vials of 10 milligrams per ml concentration. So I drew up 1 mil from each of the 5 vials. So I had a final volume of 5 mils that I injected into 45 mils of normal saline to get a final volume of 50 mils, final concentration of 1 milligram per ml. Right dose is PCA, I have the PCA MAR, I have PCA written on my label, and the right time is today now, so we're going to be going ahead and doing that. So before I do that, I'm going to ask the patient, I'm going to educate the patient. So you're receiving this morphine as a PCA due to your surgical incision pain, so you've already signed a consent for this, but I would like you to verbalize your consent to make sure that you're okay with me going through with this. Okay, patient said yes. So some of the side effects that you should watch out for are shortness of breath. If you start feeling any dizziness, nausea, vomiting, any constipation, just let me know. I've already monitored your baseline vitals and pain levels before this, but I'll continue to monitor it throughout the administration of this med. So we're good with that. I've educated the patient said yes, so I'm going to go ahead and just quickly change the bag. So remove the old bag, that is done, and I will attach the new one. So aseptically attach it to the spike. Okay, so we're good to go with this, and I'll just put this up over here, and I'll turn this on, and then it's going to ask me for a code, which I have on the back, so I'll make sure that I put the code in, so it's just going through. This is the old bag. I'm just going to put this to the side. Oh, and we have a carrier line running, so everything's infusing properly. We have a carrier to keep the thing open, and the patient has that, so it's infusing properly. Everything is attached, everything's good. So I'm going to go ahead and program my things. So I'll just do a new program. So go on that, and then I'm going to use the code. So 94629, 94629, and yes for a new program. Yes. So Our units are in milligram, we're okay with that. We have a concentration of 1 milligram per ml, we're okay with that. We have administration rate, IV, so we're using an IV route. I'm okay with that. Loading dose, we don't have a loading dose, so we were gonna keep a 0 with that. I'm okay with that. Med limits are off, I'm okay with that. And I'm just gonna click yes for next. So I'm gonna start programming the pump. I'm gonna use my MAR and my label to program it. So our bag volume is 50 mils as per the label that I have written over here. So yes for that. We don't have a basal rate, so 0. Yes for that. And the patient bolus that the bolus that the patient is gonna be receiving is 1 milligram. So yes for that. And the bolus interval is 5 minutes. So we have the lockout interval 5 minutes according to my PDM and my MAR. So we have 5 minutes lockout. So yes. Oh. Bolus interval, so 5 minutes. Yes for that. And then they're going to be receiving 12 boluses per hour because 60 divided by 5 is 12. So yes for that. And then I'm going to get a second nurse to double check everything before I click start and do an independent check. So a second nurse has done the independent check with me, so I can go ahead and press yes. And I can go ahead and just press run. So the light is flashing over here. We can tell the medication's running. I'll tell the patient, this is your PCA bolus, PCA button. So every time you press this button, you're gonna get a bolus of 1 milligram. And I'm gonna lock the pump. So I'm gonna close the pump and make sure it's locked so that no one else can come in and program it. And I'll make sure that I review the vitals with the patient, so I come back and check on them, and their call bell is in their reach, they're lowered to the ground, everything's good, and I'll go ahead and sign my MAR. So we'll be doing a two nurse check. So this is a 2 nurse check, so we'll be documenting a co-signer with that. So I'll make sure I do that in the MAR. So for now, we're good, we can leave.